Sloan here, 700 WLW. This is interesting, and I think also a long time coming. Employers are now starting to re-examine their healthcare costs. This is the time of year we have the benefits meeting, right? You find out if things are going to stay the same or they're going to contract and how much more you're going to pay, et cetera, and you got to have those health bennies, right? A lot of people stay in their jobs because of that. Well, now we have employers, generally small business people, going, you know what if you give you some money and you go find your own health insurance on the exchange, on Obamacare? That number has doubled in the last year. And joining me to talk about it from PCS Healthcare Advisors is Paul Seegert. Paul, good morning. How are you?
Great. Thanks for having me.
Yeah, this makes a lot of sense. We've talked about this before, and in that one of the biggest obstacles for businesses, regardless of what the scale is dealing with healthcare, because you need a team of people just to do this, to manage benefits and prescriptions and what all that includes. It's just easier for companies to go, look, we're not in the benefits business. We're in the making money business. We'll give you the money. You find it on the open market. Is this a reasonable solution to that? Is this water finding its own level?
I think it is. We've priced out, and it's a continuation of a trend that started quite a while ago as benefits became so inflationary, or the cost of health insurance and health care became so inflationary, we started to price out small employers. And they've always had a disadvantage as compared to their larger competitors. But when you step back and look at the long-term trends here, in 1999, 67% of us got our health care at work. And today, as of really this year, it's past what I think is a very significant mark. We're now at 49% that get our health care at work, and it's because of this type of trend. Lots of employers have said, look, I'm doing my employees a disservice. They could go to the exchange right now, especially with these expanded subsidies that last through 2025. They could probably go get subsidized care. So if you're so small as an employer that you're not subject to fines from the Affordable Care Act rules, when you do that calculation, it might just be that you could do your employees a favor by not offering those benefits.
Saves you money, saves them money in the long run, doesn't it?
Right. Yeah. Right. Exactly right. And you know what? To me, it's a scary thing that we've created, because the part that we don't talk a lot about, there's a few things, but one of them is the fact that providers, hospitals, and so on lose money on those kinds of plans. So when you show up and you have a government subsidized plan, the reimbursement rates are lower. You're asking hospitals to work at a loss for that portion of the population. They're willing to do that because they know employer plans are going to show up. And when those commercial payers show up, they charge them more. RAND just put out a study a few weeks back showing that, yes, yet again, employer plans are carrying the water, really, for the profitability of an entire fifth of our economy. They're paying 224% for the same procedure at the same facility as government payers. And these providers have to do that to make their profits. And when we look at that 67 going down to now 49, continuing to fall, we have a dwindling supply of these commercial payers. It's going to make that inflationary environment for employers even worse.
So what you're saying, this is a classic example of the snake eating its tail, right? Is that so prices are going to continue to drop if you're on government health care. Okay, great. Somebody else is paying. That cost gets shipped to those of us who work for businesses that supply health care, which incentivizes those businesses to re-examine things going, hey, this is costing more and more and more. We're going to cut it, and you go on Obamacare, which is going to force it to the shrinking number of people who get their insurance through employers the traditional way. And at the end, it's hospitals and our healthcare that suffers, what you're saying, right? The quality?
That's it. And so then when people come out and do the math and say all those that advocate for single payer healthcare and so on, when they come out, or some version of that, they come out and say, look, do the numbers. If everybody was on Medicaid or Medicare, stuff would be a lot cheaper. Well, it doesn't account for the fact that you'd have to also chop quality by 40%. You can't do it. They need 120. Why do you think we're losing rural hospitals at an alarming rate? Most of their clients are Medicaid, Medicare, or uninsured, and they can't survive on those reimbursements. And then you look at Medicare, they're cutting reimbursements. I think another 4% in September. Worsening the problem yet again.
So we want free health care. We don't want to pay high prices for our health care, our prescriptions, et cetera, et cetera. We want someone else to pay for them, and then we're angry when the cost goes up. It's classic America. We want stuff, but we want someone else to pay for it. That's the American way.
Yeah, I want to ride first class on American, but I want to pay a Southwest fare. That's what we're asking the system.
Sure, why not? I want to take.
It doesn't work.
I'm going to take out $50,000 in college loans, and I'm be damned. The government should be giving me money back. It's too much. I'm entitled to a refund.
Right, especially if I do it in a career path that's going to make me $30,000 a year.
Right. Well, is that where medicine's heading, though? Are we going to be able to sustain the top levels of pay for physicians, physicians' assistants, nurses? I mean, they get good money. Traveling nurses now are making serious bank right now. Is that going to decline?
Question. Well, it's a beautiful question because healthcare inflation has a serious lag. Because you have insurers that go out to these providers, these hospital systems, et cetera, and say, let's negotiate. And they do this in multi-year agreements. And then they get reimbursements set. Well, a lot of those reimbursements have been set and static through this period of pandemania, everything we've been through. And their labor costs and everything else have been skyrocketing. This year, 53% of hospitals are projecting that they'll post a loss.
Wow.
And so they're going to have to they're coming back to the negotiating table right now, and you can be certain they're coming with a very sharp pencil. They're not going to mess around. And that is going to translate into some very scary, that too adds to the perfect storm for these employers that are in dwindling supply that have to prop up the whole system.
So in future, then, it'll dissuade young people from getting into medicine because of the low return on investment. You still have to go and get a 4-year. You still have to do postgraduate, get a medical degree. You're in school for 8 to 10 years, internships, stuff like that. And then in your residency, and for what?
Well, you'll have to be, it's going to worsen the other existing trend, which is nobody wants to be in primary care. Everybody wants to be a specialist. So that's where the money gets made. And the same thing in the healthcare system. You show up at a facility, an urgent care, it's already been purchased by a hospital system because they need the primary care doorway to bring you into their referrals. And then you go in there and they're going to send you to their orthopedic guy or their whatever guy. Yeah. And that they have to do that to get those dollars in-house.
Paul Seegert is here from PCS Healthcare Advisors. They consult companies, big, small, medium, on managing their healthcare costs. And this looks like a great story until you start thinking about it, right, and how we're getting to here. And the reason Paul's on this morning is discovery that we have seen the number of employers providing their employees with funding for Obamacare to go on the open market, the Affordable Care Act, on the exchange and get your own health insurance because of the costs, the absurd costs of companies providing healthcare insurance through traditional means. The easier thing to do is say, hey, listen, we're going to basically give you a raise. You spend the money on whatever it is you want. You want to buy a bass boat or buy healthcare, it's up to you. Here's your money. Go buy it on the exchange, or people are doing that. But the problem is, of course, the traditional model is what supports hospitals and medicine in America. And that's what Paul's saying is that, well, okay, if we continue to go to Medicare and, it's allegedly saving me money maybe, but certainly not the system. Now we've got rural hospitals closing. We've got more managed care. We have fewer people wanting to get into medicine because of the declining benefits of all that stuff, too. At some point, then, what happens? When is the straw that breaks the camel's back here? And by the way, the camel will never be able to get in an ER because, well, it's closed.
That's right. I keep thinking we're there. We're at that moment, and then the can will get kicked down the road further. The exchanges had a 10% increase across the board for the most part this year. Kaiser Family Foundation looked across 72 different markets and did some research as they always do. So it's looking like a 10% bump, but it's shielded from the consumers that are in those plans. If you're an employer plan, it's going to be ugly at renewal season for lots of us. But that's a dwindling supply for the rest that have already shifted over to these ACA plans or Medicare, Medicaid, whatever. They're going to be insulated from those increases. Right. We put into all the rescue legislation that we're pushing these subsidies out to 2025. You've got 15 million people on Medicaid that probably don't qualify by actual income requirements. But part of this, the public health emergency and then all the extra subsidies, we're basically pushing cash into the program to mask it. So people won't feel it largely. More than half the population won't feel what's happening. but that doesn't mean it's not happening. It's still impacting the economy.
Yeah,
really
it's happening behind the scenes. I mean, fortunately, here we got word that our benefit increase, we're not going to have increases this year. Everything's going to stay the same, but I have a fear that that's probably not long. Next year, a year after, we're going to start seeing these things catch up, at least with our company anyway, and we've got really good benefits. But relative to the 92% of companies that are doing this, and that is saying, hey, listen, we're ditching Blue Cross, we're ditching Anthem, whatever it is, and we're going to give you more money in your paycheck so you can go on the market and buy something through the Affordable Care Act or the exchanges. 92%, so more than 9 in 10 of the companies that are doing this have 20 or fewer employees. And these trends, Paul, seemingly they're always going to start in small business and grow upward. What's it take for a bigger company, when we start to see Fifth Third Bancorps and Kroger, companies like that, when they start looking at their costs, which have to be enormous. These are 20 or fewer employees. How does this thing spread to the bigger companies?
We are seeing it. That's the majority, but we are seeing a minority of them that have. I've seen companies with 700 employees that have made that transition. And there are many. I have 30 or 40 conversations a week with CFOs. That's not exactly a scientific study, but it's a pretty high volume. And there is frustration out there. It's now become, for many employers, the second largest expense, and they have no real predictability around it. They get held down to the wire of renewal and then find out how much more to budget for the next year. And that's really unacceptable. And then you look at these companies that have already transitioned to this model, and there were rules put out in the prior administration that allowed for it to be a qualified benefit plan, an individual coverage HRA. So you could put money in this HRA, they could spend it and go buy a plan, and you're not going to be subject to ACA fines.
Yeah. And
so they're making that move, and many of those have seen a lot more stability than the employer market in terms of their year-over-year increases.
Paul, we're seeing so we're starting to see the worm turn a little bit. Can you give us an idea where we'll be? So if you're a Gen Zer right now, you just entered the workforce, you're all happy, you're ready to go, you got your degree or your training or your certification, whatever it is, you're in your 20s, you're headed out. Where will this generation be in, say, 30, 40 years? What's healthcare going to look like in America?
Well, healthcare is going to continue to get pushed toward government payer. And if we don't do something about transparency, and I don't have great optimism that we will, lobbying is still very effective. So more and more, we're going to continue to watch the number of commercial payers fall. And that, the part that everyone that doesn't expect, that I think will have to come along with that, is the quality will decline. So we're going to end up looking a lot more like our peer countries who have long waits for care. And, people that need chemo sometimes have to wait months to get it. Here, you need it. It's right. You're getting it in days.
Right.
You need an MRI or you need a knee replacement. You're waiting. If you just took the population of California and took the waiting list in Canada and applied it to that population, 700,000 of them in California would be in a serious waiting pattern for care. It will be hard to avoid that if we continue to under reimburse or distribute costs unfairly or unevenly. I guess fair, who cares, but unevenly.
Yeah, it's interesting because you look abroad in the UK, for example, Scotland, in England, there's a story I saw when I was over there this summer and about ambulances, right, and the strain on them. And there was a story of a pensioner, they call him retiree, who fell off his front step at his house, and it was raining, he slipped and fell, and neighbors had to come over and basically make a makeshift tent to cover him because it was raining, as it often does in Scotland, because it took 6 hours for the ambulance to come.
Yeah, you're right. Canadians it's more than a 20-week wait time between a referral from your primary care to any kind of specialist. That's the part that, when they look at all the various ways you can slice data, which it's easy to make them do what you want, these numbers, that's not something that the average consumer here realizes. So we've got Gen Z, as you mentioned, we've got a lot of younger people coming into the age of voting and having a lot of power in our system. And I think if you ask them, the average answer is going to be, we should go that way. We should have, a single payer healthcare. It's better.
Right.
Well, you only have two ways to ration a limited supply of something. One is by line, the other is by price. And we've traditionally been a price place. I don't know how well Americans would accept line. I don't think very well.
No, I don't think so either. That story is, I mean, imagine the outrage here in the United States if someone were laying outside, an elderly guy laying in the rain for 4 to 6 hours waiting just for the ambulance to show up. And yet the stories of people who have had cancer that progressed to the stage where it was stage 3 and fatal at that point as opposed to being treated. And we don't want to do that. And I think the other thing too is, in generally with younger people, is like, well, when do you go to the doctor or the hospital? When you injure yourself, it's trauma. I had a friend, I have a friend who's a dual citizen and said, if I were injured, I hurt myself, I go to the ER in Canada and get in. There's no bill. Everything's great. But as you get older and now you have illnesses of age and you have diseases and those things, they come to the States for that. That's the difference. I think it's an age, a generation gap thing. When you're young, you only worry about hurting, you're breaking an arm. When you're old, you worry about cancer and osteoarthritis, and now you're going to wait forever for that.
60,000, 70,000 Canadians a year come here. I did a vacation there and anecdotally saw it at a nice resort. They were telling me, I said, where did you go for your guys talking about a surgery? He said, I went to where you're from. So I don't have to wait. Personally, I can afford it. So I flew down, paid cash, got a surgery. And when I did research on it, he was one of 60, 70,000 a year that do that. Yeah. If they need surgery, they come here. A lot of the world does. So we don't really have a quality issue here. We have a cost issue. We allow too much waste in the system, don't have enough transparency. That could be solved. And if we would do that and create the solution, I think is right in front of our eyes. Look at LASIK. Look at some of the things that are elective, where the insurance payment model is not involved, and you have providers that have to compete in a free market environment on cost and quality like all other businesses. You see costs go down and quality go up. Why don't we have that in healthcare? Because we're not attaching what you pay as a consumer to the actual cost of the procedure. We're not rewarding you for making good decisions. We're not giving you information to make good decisions.
Right. Well, if it's all unicorns and rainbows, Paul, I'd say you don't need politicians. That's why the system is the way it is, because it gets people elected, because you get subsidy and carve outs and everything for your people who support and vote for you, much like the college loan scam that's going on with Biden right now. Paul Seegert, PCS Healthcare Advisors, always the smartest guy in the room. Paul, thanks again, buddy. I always appreciate it.
Thanks for having me.
Yeah, take care. I love having Paul on because he's so succinct about what he says. It's true. I worry about in 30 years where we're headed here.